Hi, good morning, and hello. My name is Vanessa Joseph, and I am one of the professors and instructors at JetMap School of Nursing. The class that I teach is an NCLEX review class. So basically, I am the last instructor that the students see prior to them taking exit and to also get them ready for NCLEX. Today, I come to you excited and willing to help a lot of the students and potential students in some basic information in regards to the NCLEX. I get asked a ton of questions all the time about NCLEX and preparing for the NCLEX. So I just wanted to do this video to help support our students and our future students. So first of all, let's talk about how NCLEX is scored. So NCLEX is basically scored not on a passing grade of 100% or A, B, C that we're so accustomed to growing up and going to school. So NCLEX is based off of what's called a CAT system, and the CAT system stands for Computerized Adaptive System. So when you go take the NCLEX is not expecting you to be an experienced nurse of 10 years. NCLEX is basically wanting you to be a new grad nurse, but a safe nurse. Let's say it again, a safe nurse with basically 3 weeks to a month of experience, right? So that's what NCLEX is basing your passing score on. So if the custom baseline for you to pass is, let's say, at a level of 7, and they're giving you questions on a level of 7 and you're answering them correctly, then they're going to give you questions on a level of 8. If you're answering those questions correctly, then they're going to give you questions on a level of 9. So the goal is to have difficult questions, right? Because if you're getting those difficult questions, that means you're actually doing really well. So let's say by the time you get to a level of 9, you get that answer wrong, it's going to give you an easier question, right? So you're getting your questions based off how you're answering. So you want to get those difficult questions, and you want to be a little alarmed and alert if you're getting those easier level questions, okay? So let's start off with some basic information. So there will be a next generation NCLEX that will actually be starting next year, April 2023. This was supposed to be implemented approximately in 2020 or 2021, but due to COVID, NCLEX decided to push it back. So next generation NCLEX will be effective as of April 2023. I've been telling all my students about this, and I tell them this and I tell you this not to scare you, but to let you know that the NCLEX will be changing and that you have to be prepared. So the difference between next generation NCLEX and the current NCLEX is that you will be receiving more Select All That Applies. Previously, currently for your Select All That Applies, you're getting 5 or 6 options. For the next generation NCLEX, you could be getting 7 or 8 options, okay? You'll be having case studies as well. You'll be having more drag and drops. So it is changing, and just be aware of those changes, okay? Now for the NCLEX RN, the number of questions you could get is from 75 to 145. Now, a lot of my students have asked me, oh, if you get 75, that automatically means you pass. No. If you get 75 and the computer shuts down, that means either one of two things. Either you did really well or you didn't do quite so well, okay? So just because you take 75 and the test stops at 75, that does not mean that you passed NCLEX, okay? So the questions are from 75 to 145, and you have up to 5 hours to take the exam, okay? Now, one of the other questions I tend to get a lot from students is, how many questions should I be doing daily, right? Even when I was in nursing school, I heard this. Oh, I do 100 questions a day. I do 200 questions a day. Students, again, think of quality and not quantity, right? So if you do 100 questions a day, but while you're doing the questions, you're on social media, there's noise in the background, you're not really focused, how well are you doing, right? But if you do 40 questions a day and you go do it at the library and you're reading the questions, you're reading all the rationales, that person who's doing 40 questions a day is having more quality of testing and studying than the person doing 100 questions a day. So please don't think about the quantity of the questions that you're doing, but think about the quality of time that you're spending studying and staying focused, okay? When I was studying for NCLEX, I would wake up 30 minutes earlier before I had to get my kids ready for school, and I would do 10 questions and read the rationale because I needed that quiet time. I needed to be focused. I would go to Starbucks and focus and study because my house will be hectic with my kids sometimes, right? So think about the quantity of the studying and not the quality, think of the quality of the studying and not the quantity, okay? Another question that I tend to get often is, I don't know if I should be doing content or if I should be doing questions. Students, do both. You have to know your content in order to answer the question. The reason why I'm so big on content and why content is so imperative, when you know the content and you have 4 question selections, you could at least eliminate 1. So it gives you only 3 answer choices to look at, right? So knowing content is gonna help you with process of elimination. You know, there's no way you can answer a question without knowing the background information or without knowing the content, okay? The questions are gonna help you critically think. That's why you do questions and read the rationale, okay? So just to give you an example on how important content is to when you're answering NCLEX questions, let's go over some content. Okay, knowing the content will assist you in process of elimination. Doing questions and reading the rationale will help you critically think. So let's talk about lab values, right? The lab value for sodium is between 135 and 145, right? Anything lower than 135 is considered hyponatremia. Then I tell you, anything considered over 145 is considered hypernatremia, right? So I gave you the content. Sodium is between 135 and 145. Anything lower than 135 is considered hyponatremia. So let's look at a question, right? Question number 1. The nurse on the medical surgical unit has just received a client with hyponatremia. What findings should the nurse expect, right? So let's look at the answer choices. Number 1, serum sodium level of 155. I just told you with the content, and the content you could get in your Saunders book or whatever studying book you're using, that sodium is between 135 and 145. Anything lower than 135 is hyponatremia. So 155 is not hyponatremia. It's hypernatremia. We're looking for hypo. So we could already eliminate option number 1. This is why knowing your content is important, right? So this is a select all that applies question. So we already striked out number 1, right? So let's look at number 2. Patient has a diagnosis of CHF. Let's look at number 3, patient complaining of abdominal cramps. And let's look at number 4. Patient is lethargic. So the signs of hyponatremia will be 2 and 3. Because number 1 is hypernatremia. And number 2, diagnosis of CHF. When you're on diuretics and you're urinating and you're on Lasix, your sodium will be low. Complaining of abdominal cramps is a sign of dehydration. Dehydration leads to hyponatremia. If a patient is lethargic, that is a sign of hypernatremia, meaning their sodium is high, okay? So another thing that I really emphasize and tell my students that's very important is knowing NCLEX language, right? You could know the content, you could do the questions, you could read the rationale, but you have to know NCLEX language. For example, so we all know about COVID and we all know what an N95 is, right? So NCLEX is no longer using the term N95 in their answer selections because everyone knows what an N95 is, right? So let's look at the next question. The nurse preparing to provide a total care patient with measles a bed bath. The nurse should wear which items? Number 1, a surgical mask and gloves. Number 2, a surgical mask, gown, and gloves. Number 3, particulate respirator, gown, and gloves. Or number 4, particulate respirator and gloves. So what's the correct answer? The correct answer is number 3. NCLEX is no longer using N95. They're using a particulate respirator. This is a N95. So if you don't know NCLEX language and you're used to just a N95, you could get this question wrong. This is why it's imperative to know NCLEX language. This is why it's imperative to know your precautions. So you know when a patient has measles, they're on airborne. Airborne, you need an N95 or a particulate respirator. This patient is bedbound, so you're going to give them a bath. So you're going to wear a gown just in case you get water to splash on you, and you're going to wear gloves, which is basically standard precaution, right? This is why it's imperative to know NCLEX language. Another thing that I wanted to mention about NCLEX language. You know how you're learning about Cushing's syndrome and one of the signs is the buffalo hump? You're not going to see buffalo hump. What you're going to see is supraclavicular fat pad. Supraclavicular fat pad is another word for a buffalo hump. So this is why you have to know NCLEX language, because it's going to help you getting those answers correctly, right? You don't want to get an answer wrong if you know the information. So you have to know NCLEX language, okay? Another thing that I always stress to my students is that NCLEX is not black and white. NCLEX is not one of those tests where you just read the information and the answer is in the passage. It's not a reading comprehensive test, right? So I stress that to the students as well. So there's certain things you do have to remember for NCLEX. Like, for example, your lab values. You cannot go to NCLEX without knowing your lab values. You have to know your lab values because you're going to get so many questions on a presentation of a patient and they might include the patient's lab values. So you have to know your lab values. You have to know your scope of practice. So you have to know what the RN scope of practice is, the LPN scope of practice, and the UAP. NCLEX is not going to use CNA or Certified Nursing Assistant. UAP stands for Unlicensed Assistive Personnel. So that's another NCLEX language you have to know, okay? So you have to know lab values, scope of practice for RN, LPN, and the UAP. You have to know your dosage calculation formulas, and you have to know your safety, which is like your infection control. Okay? So priority and delegation is really big on NCLEX. So let's look at a question in terms of how it relates to priority and delegation, right? So let's look at the next question, this question right here. The nurse has just received report on 4 patients. Who will the nurse see first? This is a priority question. Number 1, patient with COPD with an O2 stat of 89%. Number 2, a patient with heart rate of 110 beats per minute after an albuterol treatment. Patient number 3 with dementia with a new onset of altered mental status. Or patient number 4, patient 24 hours post hip replacement surgery reporting slight pain. Let's look at some of the cues, right? So this is a priority question. Who should we see first? When you read these patients' presentation, you have to ask yourself, is this expected for that patient? Let's look at patient number 1. Patient with COPD with an O2 stat of 89%. This is expected for this patient. For your COPD patients, they're going to have shortness of breath. This is expected. Do we want them at 89%? Of course not. We would love them at least at 90 or 91 or 92. But in NCLEX, your COPD patients could go as low as 88%. So this is expected for them, right? So let's look at patient number 2. Patient with a heart rate of 110 beats per minute after an albuterol treatment. So we know we typically want the heart rate between 60 and 100, right? But this patient just received the albuterol treatment. One of the side effects of albuterol is tachycardia. So this is an expected finding, right? Let's look at patient number 3. Patient with dementia with a new onset of altered mental status. Okay. And let's look at number 4. Patient 24 hours post hip replacement surgery reporting slight pain. Guys, read your question and your answer selections more than once. And look for cues within the answer selection. Look at this key word, new onset. This is something new that the patient is experiencing. They were not experiencing this before. So just because the patient has dementia and he's probably confused now, that doesn't mean this is not a priority, because this is new. So he's probably in his early stages of dementia, and now all of a sudden he has a new onset, right? So this could mean, hey, maybe he has a urinary tract infection and he's having altered mental status because of that. So this patient will have to be your priority. They give you a clue in here. New onset is the clue. Let's look at patient number 4 again. Look at this key word, slight pain. This patient had surgery 24 hours ago, hip replacement surgery. Are they going to experience pain? Of course. Do we as nurses want our patients to be in pain? Of course not. But is this expected? It is. And not only that, they're in slight pain. So your priority patient that you have to see first is patient number 3 with the new onset of altered mental status. Okay? This is why it's imperative to know your content. If I did not know the content about the albuterol treatment, I would have said, oh my goodness, that number is out of range. But it's expected to be out of range because of the albuterol. That's the side effect of albuterol. Okay, guys? Another way that I typically explain priority to my students is I use myself as an example. So I'm 37. I have no medical history. I don't have any hypertension or anything like that. No past surgeries. I've never been hospitalized. Only my 2 deliveries where I was hospitalized, right? My father, who's 75, he has hypertension, he has diabetes, and he has hyperlipidemia. So if I go to the emergency room and my dad goes to the emergency room and my blood pressure is 180 over 100 and his blood pressure is 190 over 110, who do you think they're going to see first? They're going to see me. I have no medical history of hypertension or anything like that. So it's not expected for me to have this such elevated blood pressure. But when they see my dad, they're going to be like, maybe he's not taking his meds. Maybe he needs a med adjustment. Maybe he's under some stress. So I will be priority. Don't look at age as a factor. Look at the signs and symptoms and the presentation of the patient. Okay? Perfect. So let's move on. Last but not least, my students' favorite and everybody's favorite, select all that applies questions. Okay? When I was in nursing school, I hated the select all that apply questions, right? But it's on NCLEX. You have to do it. You have to know it. You have to practice it, right? If it's one of your weak points, you have